Welcome back. You're watching McLaren Port Huron's Today's Health, and I'm talking about atrial fibrillation with cardiologist Dr. Gundlapalli. Okay, Dr. Gundlapalli, what is the goal of treating atrial fibrillation?
The goal of treating is first to make patient comfortable if they are having symptoms of palpitations. This can be achieved with the control of the rate. The other aim is to establish a regular rhythm if it's possible. It may not be always possible, that's another thing. Third thing is to reduce the risk of embolization or clot formation. These are the aims of treatment for atrial fibrillation.
And what treatments are available?
Medications to control the heart rate or to establish heart rhythm back, and there are medications to make the blood thinner. And there are also options of cardioversion, where we can use electrical shock to make heart back into regular rhythm. And also what we call ablations. Sometimes they go inside and burn certain tissues to establish a regular rhythm.
How do you decide what methods are appropriate for the patient?
Well, there are different approaches. You know, if you are elderly female or male, and if we don't have much symptoms, the rate control, just make the heart rate control and giving the blood thinners may be sufficient for them. For a young man, and if they are very symptomatic in their long life, establishing a regular rhythm becomes important. So depending on the age, symptoms, we decide how to treat the patient.
Well, let's talk a little bit more about medications. I think that's interesting the way you laid that out. Tell me again about the treatment with medications for atrial fibrillation.
Yeah. Rate control is one of the mainstay of the therapy. For the rate control, we have what we call beta blockers, calcium channel blockers, or digoxin. These are the choices that we use to control the rate. Whereas there are other medications we use for rhythm control. There are several medications that we use. They are called flecainide, Rhythmol, dofetilide, amiodarone. There are other choices that are available to establish a regular rhythm. But these medications normally have higher risks of causing what we call proarrhythmias and other risks. So we are careful to using those medications. And lastly, blood thinners to prevent clot formation. And these blood thinners traditionally used to be only one medication, Coumadin, in the past. But over the last 3 years, we had several choices. The newer medication that came aboard, we call it Pradaxa, Xarelto, you might have heard about it on the TV. These are easier to take, the medications, because you don't have to worry about the diet and other medications that you take concomitantly, but these are costly medications.
Let's talk a little bit about lifestyle changes. Those we never want to hear about, but are things these patients need to change?
Oh yes. I think alcohol intake, if you can cut back alcohol intake, cut back on the caffeine, regular exercise, maintaining ideal body weight, and if you have sleep apnea, treating sleep apnea, all these things would help.
And how about procedures then? What might be effective?
One of the procedures we routinely use is cardioversion, electrical cardioversion. If somebody comes to the hospital with atrial fibrillation with a rapid heart rate, if they come within 24 hours, we can use this electrical shock to make it regular. But if they come late, we have to use blood thinners for 3-4 weeks before we use the cardioversion. And if these fail, and if the people keep going into atrial fibrillation, we can use what we call ablation, where doctors can go with the catheter inside and burn certain tissues to stop this arrhythmia permanently.
So is an ablation a permanent solution to atrial fibrillation?
Yes, when it's successful, it could be permanent. The success rate for atrial fibrillation is about 70%. Sometimes you may have to do it again, but if it is successful, it is permanent. Though some certain people it can recur, it can come back, but most of the times, hopefully, it is permanent.
Are most people able to be treated by medication and lifestyle, or is it always a combination of the three that you're looking at?
Yeah, it's a combination of things. Some people are comfortable with just rate control at blood thinners. That becomes easier. Sometimes they're very symptomatic, or if the heart muscle is getting weaker, then we have to do all that's available to make it regular. So it's always a combination of things.
What if none of these procedures are effective? Are there other options?
There are a couple of options. If somebody's heart rate is fast and we cannot control them with medications, we can do what we call AV nodal ablation. That means we can go inside and make the AV node which conducts the electric impulses from top to the bottom. Then we can burn that so that no impulse goes down to the bottom of the heart. And at the bottom of the heart is activated with the pacemaker.
Okay, all right. Well, pacemakers are a whole nother topic, and we're going to take a break and come back and talk a little bit about them.